You're really sort of set up to fail in this space, no matter what you do. It's the title of a report by a great organization here called Feed UK. They said that we're being set up to fail because we're stigmatized if we formula feed, we're told to breastfeed, but then not given any practical support to do it. And so everybody just winds up feeling kind of rubbish about what they're doing.
Welcome back to the famous podcast. I'm Françoise Girard and I'm really pleased to see you. I was away for the summer. I had to deal with my mother who broke her pelvis. It was a tough summer, but I'm really glad to be back with you all. And she's fine, so just so you know. Today I'm very, very pleased that we have with us Rebecca Steinfeld. Rebecca is an expert in reproductive rights. She holds a doctorate in politics from the University of Oxford and is a researcher on sexual and reproductive health and rights in the UK and a campaigner on these topics in the UK. And she works on a range of issues in sexual and reproductive health and rights, including contraception and abortion. And I've really enjoyed getting to know Rebecca over the last few weeks and getting to know her work. Now, one of the issues Rebecca works on and is very passionate about is infant feeding, which is how she prefers to frame the topic of breastfeeding. So this is what we're going to talk about today on the famous podcast. Is breast best, and for whom? Rebecca, you work in reproductive rights, which as a field has no shortage of hot button issues, right? We agree. Lots of topics that are very controversial. Yet when we spoke a little while back, you told me that breastfeeding is the one issue that generates the most explosive reactions whenever you speak about it on the panel. And I must say I was a little surprised by that. Really? Breastfeeding? But we are bold and unafraid here on the famous podcast, so we're going to discuss this and dive into it. But let me, before we go anywhere, be clear at the outset that you're not connected to manufacturers of breast milk substitutes, right? No,
I'm not.
No. And also, just so to be clear, because that's something that might come up. And also, I want to be clear that our discussion is inclusive of women and all persons who breastfeed or chest feed, including trans men. So you'll notice that we'll try to be as inclusive as possible. Sometimes we'll say women, but we mean to include all people who chest feed or breastfeed. So tell me, why is breastfeeding such a hot button issue?
Well, it's actually unclear to me, to be honest, exactly why this issue is in the same league as things like genital cutting or debates about abortion or Israel-Palestine, which are some of the things that I have worked on in the past. I think that some of the sort of speculations I have about this are that I think infant feeding is often a proxy for debates about mothers and about the role of mothers, and moralizing about motherhood. So I think when we're speaking about infant feeding, sometimes I think we're really thinking about mothers and about women to a certain extent as well, and what they should be doing with their bodies. And I think it's also because I think this issue can divide feminists in ways that I think are very logical. Like, I think that there are sort of two ways you can come to this issue as a feminist. I think some are very concerned about the pressure, for example, coming from international non-governmental organizations like the World Health Organization, who are putting pressure, as they see it, on women to exclusively breastfeed. And they would say that this undermines women's autonomy and their freedom to choose. But then I think you can flip this, and there are other feminists who would say that they're really concerned about formula companies undermining women's belief in their own bodies and in what they can naturally do. So I think that infant feeding actually splits feminists. And then I think maybe the final reason for this sort of strength of feeling is that we all have experiences of being fed and also of feeding ourselves and of feeding others. And I think feeding and eating are simultaneously really mundane, everyday experiences that we all share. And then also actually quite complicated, perhaps especially for women. So I think that this is one of those issues that just hits a lot of raw nerves for different people and brings out a lot of strong feelings.
Yes, and also a very intimate issue. Huh? Yeah.
Exactly.
Yeah.
Yes.
Yeah. Now, why is it an issue that you are passionate about? Because I know you are. You told me that.
Yeah, absolutely. I think that there are three reasons that have really drawn me to this issue and galvanized me into campaigning for change. One is to do with what I see as the harm being done to women in this space. And I've witnessed the pain and the suffering and the trauma of the pressure to exclusively breastfeed in particular, which is national policy here in the UK and in many other countries across the world. I've watched friends and colleagues and people in online forums feeling pressure, feeling stigma, when they either can't or don't want to breastfeed their babies or don't want to do so exclusively. So I worry about that. I worry about the harm to babies that is inadvertently and unintentionally being caused by this policy. So, just to say on that there is evidence emerging that babies are going hungry and are being readmitted to hospital due to insufficient breast milk intake. And in fact, jaundice is listed as a risk factor for exclusive breastfeeding, which leads me to wonder whether this policy that calls itself the Baby Friendly Initiative is actually helping babies. So I think these two things, this harm to women on the one hand, and then the emerging evidence of harm to babies on the other, kind of piqued my curiosity about this issue. And I started then to sort of do some digging because I wanted to see if there was really good quality evidence to back up this whole range of claims around the benefits of breastfeeding, which underpins the whole breast is best mantra. And essentially what I found was that that's not the case. And we can talk more about that later, but that essentially like the good quality evidence only supports a few of the benefits here. And all of that made me very passionate because I was thinking, well, hold on a second. We've got this very interventionist policy that is, telling women what to do with their breasts, or non-binary, gender non-conforming trans men to do what to do with their chests. It's very intimate. And yet it's based on this really quite flimsy evidence. And I feel like it's a bit of a scandal hiding in plain sight, to be honest. And I think it also sets a really problematic precedent where we will accept a highly interventionist public health policy on shaky ground that is having like a very significant impact and has, a huge amount of expectations of what people will do. Because we're talking about with exclusive breast or chest feeding, on demand, round the clock, every few hours, sleep deprivation for months, if not years on end. So for me, I think we really need to be questioning this policy, challenging it, asking for better evidence if it's to be sustained, or for a change of policy if actually the evidence isn't there to back it up. So that's why I'm passionate about this.
Yes, I can see. And so there's lots of things there that I think we need to explore. One of them is because you said, in fact, it's very difficult for women to maintain the recommend. So first of all, tell me, what are the recommendations with respect to breastfeeding, including exclusive breastfeeding, the global recommendations of the World Health Organizations, and what is it in Britain? Is it the same? And then what is the reality? How are women able to manage this?
Yeah, I'm happy to speak to that. So in terms of the recommendations, the World Health Organization and UNICEF both recommend that women initiate breastfeeding within the first hour of birth, and babies be exclusively breastfed for the first 6 months of life, meaning that no other foods or liquids are provided, including water. They say that infants should be breastfed on demand, so rather than according to a schedule,
Right.
as often as the child wants, day and night. They say that no bottles or teats or pacifiers should be used, and that from the age of 6 months, children should begin eating a safe and adequate complementary foods while continuing to breastfeed for up to 2 years of age and beyond.
Right.
So that's what everyone's being told, and that is what is effectively brought into UK health policy through the UK UNICEF Baby Friendly Initiative, which is endorsed here in the UK through the NHS, through the National Health Service.
Right.
So that's the official line. The reality is starkly different. So what we have is that, according to the most recent data, we have around about 3/4 of women in the UK start breastfeeding. So that's first feeders of breast milk. But by 6 to 8 weeks after birth, only about 50% are doing any breastfeeding. And by 6 months, levels of exclusive breastfeeding have decreased to only 1%.
Wow.
Which means that 99% of babies are being fed formula milk, either partially in combination with breastfeeding or exclusively being fed formula milk. And I think beyond just the recommendation and the reality, I think there's the result here, because what happens in a situation where you've got a very heavy-handed policy telling women to breastfeed exclusively, 99% are not doing that. Well, quite predictably, you've got very high levels of negative emotions around the use of formula. So, for example, one study found that 67% of women felt guilt, 68% felt stigma, and 76% felt the need to defend their decision to use formula milk.
Yeah.
And the study authors then concluded that the current approach to infant feeding promotion and support in higher income countries may be paradoxically related to significant issues with emotional well-being. And that is exactly, again, coming back to why I'm so passionate about this.
Yeah.
That's what I've witnessed. That's what I've seen so many friends and colleagues and people in online forums going through, this like intense stigma, shame, and guilt around formula feeding. Things like people hiding cans of formula milk in their trash, in their recycling, because they don't want people to see that they're doing it. So, yeah, there's obviously a big gap between rhetoric and reality.
Yeah. I was looking at the global statistics on that front, and globally, I found that only 44% of newborns are exclusively breastfed from birth to 6 months. So that's worldwide. A better number than 1%, but it's still, again, more than half of parents cannot breastfeed or chest feed exclusively. It's just not happening for many reasons. We can discuss what the reasons are, but it's not happening. And the policy continues to be exclusive breastfeeding. So that's an issue. When a policy and the reality don't correspond at all, we have to say what is going on here and what can we do? No, I mean, it seems to me that there's something there that we need to look at clearly, like without, with the rose-colored glasses. We need to look at it clearly. Now, one of the things that I find interesting is also the fact that this whole debate about breastfeeding and this whole set of recommendations comes out of the scandals around the behavior of the multinational Nestle in Africa in the 1970s and 80s. Like, going back into the history of infant formula, I saw that it was invented in Germany in the 19th century and taken up gradually by women, especially women who were going to work in factories because they just couldn't cope with breastfeeding if they were also going to work. So you could question whether it's a good thing that women went into these sweatshops and these terrible factories in the 19th century, but they did. And then after the Second World War, there was a real uptake of infant formula in the global north. But when the birth rate started to go down, and therefore the formula manufacturers found that they weren't able to sell as much, they turned their eyes to Africa, right, to see if they could market their products there. And that's when abuses arose, because the formula being pushed in Africa required access to clean water, obviously, to mix the powder with, to produce the formula, which was a big problem in a lot of communities in Africa. And so, thousands of babies died at the time because of the lack of the solution of infant formula, which was presented also as modern and better for babies and improved nutrition and all that, didn't correspond to the reality on the ground in a lot of these communities in Africa. So that's how the scandal with Nestle arose, a very justifiable scandal, and the push to revive and maintain breastfeeding began globally, with public health activists and feminists and all saying, no, these multinationals cannot, push us to abandon breastfeeding with these deceptive practices, So, and that's how the International Code on Breast Milk Substitutes was adopted by the World Health Organization in 1981. So there's a lot of history there about also the bad behavior of international companies. So it's complicated. It's not just, good guy, bad guy, black and white.
Yes.
There's lots of issues that come together in this debate, no?
I think that's absolutely right. I mean, I think the history of milk, and especially of formula milk, is fascinating, and it is complicated. And I think you do have to unpick and unpack quite a lot here. To be crystal clear, I think that what Nestle did in the 1970s is absolutely horrendous. Thousands of babies died. They marketed formula in a context in which it couldn't be prepared safely inherently, because there wasn't access to clean water, there wasn't adequate heat to sterilize containers. The price point compared to the income level meant that rationing was inevitable, and they deployed very underhand marketing practices, like dressing up marketing salespeople as if they were nurses, and I think some accused them at the time of corporate genocide. And I think that, I'm not going to pull any punches here. I think it was horrendous.
Yeah.
And I think that there are still concerns today about safety of formula access and provision in the global south, though I think we need to be careful about who we're talking about and where we're talking about. And I also think that we need to be careful here to distinguish between the practices of the formula manufacturers and the product of formula milk itself.
Right.
Because I think that, there's another way and another context in which one can think about the advent of formula, and that is very much a scientific innovation. And yes, perhaps driven, by profit-making industrialization motives, but also with the potential to liberate women in all kinds of different ways, to do other things than have to feed their babies. And, formula milk today, particularly in the global north, is a life-saving and life-sustaining product that, supports millions of babies to survive and thrive. And I think we also need to be careful to remember the sort of before times when, some people might look back through kind of rose-tinted lenses and think, well, before the advent of formula, women were all just happily breastfeeding.
Right.
And it was all, just lovely and natural. But actually,
no.
Again, it's complicated. And what was actually going on was that for some people, it worked very effectively and efficiently. For others, it didn't, as it doesn't today. And those women, if they were able to afford it, could employ wet nurses. But if they couldn't, they would feed their babies all sorts of different things, like sweetened tea, also made with, dirty water, and not providing sufficient nutrition for a newborn baby, or unpasteurized cow or goat's milk.
Yeah.
And infant mortality was through the roof. So I think we've got to be really careful here not to romanticize the period before formula milk, and to and not to just demonize formula milk because of the practices of formula companies, and to remember that as long as people can afford to buy it and have access to clean water and heat sources, that then it can be an incredible scientific innovation that is life-saving, life-sustaining, and liberating.
Right. Yes, exactly. And we do accept the benefits of scientific progress in many other fields, right?
Exactly.
Yeah. So let's get back to the question of breastfeeding. I mean, it is hard, I think we alluded to the fact that very few women can maintain it exclusively. It's because there is the whole question of work not providing accommodations. I know in the US, where we don't even have paid maternity leave, that it's a big issue, that for a lot of women, it's completely impossible to breastfeed exclusively because they have to go back to work within 2 weeks or 3 weeks. And there's no place at work where they can pump or store the milk. It's just really, really hard. So there's all that lack of support in the workplace and of the conditions of work that make it very difficult. But there's also the fact that it's not easy physiologically. I mean, the baby might not latch, the milk supply might not be sufficient, the baby might be undernourished because you can't tell how much the baby is drinking. So you find that the baby's losing weight. There's lots of issues, right, that come into breastfeeding and make it hard.
Yes. I mean, I think that both breastfeeding and formula feeding can be hard for different reasons. And they can also, work well for different people for different reasons. So I think, for some, you can have a relatively easy breastfeeding experience or journey, as people sometimes refer to it, where the baby latches very easily, you have minimal pain or discomfort, you've got a plentiful supply but not too much,
right.
And actually it works very well in terms of being sort of more convenient, because you can avoid the faff of sort of having to clean and sterilize bottles, and you avoid the cost of having to pay for formula milk, although of course you have the added cost of slightly increased nutritional needs that a breastfeeding woman or chest feeding person would have. I think that formula feeding has advantages too, in the sense that you're able to share feeds, which can be beneficial in terms of allowing you to get more sleep and recover in the postnatal period. Develop bonds between the person who's feeding and the baby, and it not just simply being about the person who's lactating, that having that special relationship. I think in terms of like the sort of legacy of who's responsible for feeding the baby in terms of the division of labor within the household, there are advantages to either formula feeding or combination feeding, which I think is an increasing practice that is not talked about enough, where there's a combination of breastfeeding and formula feeding, depending on the time of day, the feed that it is, things like that. So that
and how hungry the baby is also, right?
How hungry the baby is, what your milk supply is like. Yeah. So I think, both have their advantages and disadvantages. And I think what we really need here is to talk about that, and to not focus so much on the mode of feeding, but to acknowledge that the most important things here are that you have a well-fed baby and that you have a happy mother / primary parent.
Right.
And that's going to look different depending on the situation that you're in, the sort of the state you're in physically after birth, and in general, the situation you're in terms of your relationship, whether you have other caregivers who can share the load, whether you've got other children, your mental health. Obviously sleep deprivation can be a trigger for new mental ill health, and or can exacerbate existing mental ill health. And we know that postnatal anxiety and depression are huge issues for lots of women. Postnatal psychosis as well can be hugely triggered by sleep deprivation. So you've really got to think about the individual and their situation. And I really think that individualized approach is what's best in this situation, rather than a policy that is focused on breast is best, on one mode of feeding, one mechanism of feeding working best for everyone in all situations, because that obviously isn't the case. And it's at odds with the talk and arguably service delivery and so many other elements of reproductive healthcare, where we're so focused on, are we giving someone the information that they need to be able to make the choice that's right for them? How can we support them to then make this choice a reality? And yet in this space, it's like we shelve all of that and we say, no, everyone has to do this one thing and they have to do it exclusively.
Yeah.
And there, I think we've got a major problem on our hands.
That's right. And I think the point about mental health you raised, when we were talking earlier, and that's something that is really under addressed, in postpartum everywhere. I know in the US, we're only really getting to the part where we're really discussing postpartum depression and psychosis and the need to medicate. And now, we even have now a Minister of Health, RFK Jr., who's saying you can't take Tylenol during pregnancy. So women are getting bombarded with messages about you can't take anything, you can't do anything artificial. And yet these are real, very real and serious issues, dangerous issues, notably with mental health, where we're walking away, certainly in the US, from actually addressing these concerns. Yeah.
I think that's right. I mean, I think one of the changes I've observed, at least in the UK context over the last, let's say, decade, is I think we talk a fine talk now about maternal mental health and the need to raise awareness of it and to normalize it, being okay, not to be okay, and things like that. But I think that sadly services lag behind in terms of actually providing care to support women when they're in the throes of, perinatal anxiety, postnatal depression, or whatever it is. And, when it's particularly acute, women's needs are by and large not being met. Certainly in our under-resourced, overstretched National Health Service, that's the case. Like in many things, obviously, if you have the money, you can circumvent the state provision, and you can, assuming you can identify that you have a need, or other people can identify that, you need support, you'll hopefully be able to access services. But certainly there's quite, significant inequalities in relation to access.
Right.
But I also think that people are not paying enough attention to the way in which infant feeding policy is directly feeding into this, excuse the pun, but that, that you've got a policy that is exerting so much pressure that, the majority are not sticking to, that they're going to all these different public services and they're being inundated with the same message. And I know I'm a mum of 3 and I have sat in so many different, the GPs, general practitioners, waiting rooms, or, in the maternity services or in the health visitors. And they're all part of the UK UNICEF Baby Friendly Initiative. And that puts all these limitations on what they can and cannot show in terms of the imagery and the messaging. And, for example, they can't show positive imagery of a baby being fed a bottle. They're not supposed to show images of babies with pacifiers.
Wow.
All these kinds of things, because it's all against, the WHO and UNICEF's policies and recommendations. So what happens when you're sitting there as a new parent, washed with hormones, sleep deprived, and you're seeing posters saying things like, that someone's breast or chest feeding saying, this is how you bond with your baby. And you're sitting there thinking, oh my God, I'm not bonding with my baby because I'm not feeding it through my breasts. And again, I just think there's so much kind of left hand not talking to right hand. We're talking such a fine talk about mental ill health in the perinatal period, but we're not providing the services and we're not making the links to some of the other policies that we've got that are contributing to these feelings.
Can we get back to the question of whether or not breast milk is best? What evidence is there that breast milk provides enhanced immunity or, protects against whatever, conditions there is a bit of evidence on that, but it's not as overwhelming as I thought when I started looking into it. And you alerted me to that, so I thought that was quite interesting. Can we talk about that for a second? Because I think that's, as people are listening to us, they're going to go, yeah, but it is better because, so therefore
Yes.
it is justified.
Yes.
Let's get into that. What's the evidence for breast milk being better?
Okay, so this is fascinating. So what listeners may or may not know is that there are an enormous number of claims that are made about the benefits of breast milk and or breastfeeding.
Yeah.
So those range from sort of short-term health benefits for the baby, long-term health benefits for the child and adult they'll become, long-term benefits for the mother, and then sort of planetary claims about, how breastfeeding is better for the environment, etc. So there's like these kind of 4 categories of claims. And it's things like, in terms of long-term benefits for the baby, that it'll, for the child, rather, that it improves IQ, that it reduces the risk of obesity, for the mother, that it similarly supports weight loss. Okay, if you then actually start to look at the evidence that these claims are based on, you start to realize that only a few of them are supported by good quality evidence. And the rest of them are supported by poor quality evidence that confuses correlation for causation and essentially doesn't recognize that the mothers who are breastfeeding in the global north, at least, tend to have different attributes or experiences than the mothers who are formula feeding. And generally that is that the breastfeeding people are older and they're better educated.
Yeah.
And so that's what we call a confounding variable. So essentially the things, it's not because of the mechanism of breastfeeding or the mode of feeding their babies breast milk that's resulting in these better outcomes. It's the fact that they tend to be older, better educated, from a higher socioeconomic background. And that's the causal effect.
Yeah.
But having said that, I'll absolutely acknowledge that there are certain benefits at a population level. And that's important because if we're going to inform women and people about, the benefits here, we have to make it clear that they may not even notice these individual benefits for themselves, for their own baby, between, formula feeding, breastfeeding, or a combination. But those benefits are, for the baby, there's good quality evidence to support fewer allergic rashes in babies, fewer gastrointestinal infections. There's maybe some evidence around reducing the incidence of ear infections. And there's some good quality evidence that breast milk reduces the incidence of necrotizing enterocolitis, which is a rare but potentially fatal condition in particularly premature babies. So that's what you have for the baby. The good quality evidence does not support any of the long-term health benefits for children. For the mother, the only thing that we've got good quality evidence for is around reducing the risk of breast cancer. But everything else essentially falls by the wayside. And again, this is population level stuff. So,
thousands of people. Yeah.
It's thousands of people. So for you as an individual, you might not be reducing your actual risk of getting breast cancer, from 2 years of exclusive breastfeeding by very much. And you've got to make this decision. I mean, I think this is the crucial thing here. You've got the kind of, what are the benefits of breastfeeding or breast milk? That's part of this. But it's not just a decision you make in isolation based on that alone. You've then got to think about all the other factors in your life at this point in time that will make this, either a sensible thing to do or potentially something that's going to cause you sleep deprivation, undermine your mental health, put strain on your relationship, et cetera, et cetera, et cetera. And also what's your own individual supply like? And all these other things. So I think we've got to be careful about, the way we communicate the evidence,
the benefits,
so individual population level, and the context in which we sort of empower people to make a decision based on the evidence that we're giving them.
Right. And conversely, now I need to say also that the fact we don't have evidence doesn't mean there aren't other benefits that we just don't have the evidence for, right?
Absolutely.
But we don't have it, right? So that's that. And conversely, breast milk substitutes aren't shown to be superior to breast milk. It's not like, when Nestle was going around Africa in the 70s saying it's superior and, it's modern and this and that. There's no evidence of that, right? So it's not
No, I mean, I just say a few things here. Like, firstly, I think you're right. You're absolutely right in relation to breastfeeding. The absence of evidence doesn't mean that it's not the case. But at the same time, until we have the evidence, I think we should be very careful.
Yeah.
Well, yeah, we should not be overclaiming. Well, not we, but like, public health policy bodies shouldn't overclaim. They shouldn't create a highly interventionist, pressurizing policy that 99% of the population is not following without that evidence. So I think that's really important to say that. I think in relation to formula milk, there's no, in terms of the actual milk substance itself, there's no additional benefits as far as I'm aware, except to say that obviously, assuming someone is able to afford it, which is a whole other question, that it is, in plentiful supply. And there are questions about insufficient breast milk and insufficient breastfeeding that I talked about earlier. So there's that. And then again, this is about the sort of the benefits that exist outside of the product. So
itself, right? It's not the product itself. It's more, you can measure how much you're giving the baby. You can see whether he or she drank the bottle or not, which is hard to see with the breast, right? So that's what we're talking about.
Right. You can share feeds. Feeds. I mean, you could argue, for example, that where you have babies that have severe allergies to cow's milk protein or they're lactose intolerant, you can get specialist formulas that mean that the person, who's breast or chest feeding doesn't have to eliminate those things from their diet.
Right.
You could argue that's an advantage. But I think in terms of the actual
substance
product, no.
Yeah.
Of course, I'm sure formula companies are working on, ways to, try to mimic breast milk as far as possible to create a even more lucrative product. And I think that there's, one of the things, thinking back to what we were talking about earlier in terms of really problematic practices, one of the things that drives me nuts in this space is that formula companies, even today, engage in dodgy marketing practices that I think really exploit the maternal guilt and shame in this area. And one of those things is around they differentiate within the brand by having different labeled products. So you'll have, like, for example, like a kind of a stage 1 infant formula, and then you'll have something that's called an advanced or some other kind of premium product that'll be nearly, twice the price. And the implication is that this is a superior product. But actually, at least in the UK, and I believe according to EU law, and I don't know about the situation in the US and with the FDA, but over here, my understanding that is if a particular ingredient has a proven health benefit, it has to be introduced across the board in all formula milks.
Right.
And that all formula milks, therefore, are nutritionally equivalent. So I think it is totally outrageous that you have a situation where these formula companies are really exploiting the fact that lots of people don't know that. And one of the things that I would like to see is that we have very clear front of shelf in supermarket or grocery store messaging that all formula products are nutritionally equivalent. Don't be fooled by, the labeling.
Right.
And what I really wish is that we had all of this happening in antenatal education inside NHS hospitals, etc. But we don't, because no one's allowed to talk about it.
Formula, right.
No one can talk about formula. So you can't, what should be happening is that, again, this is like for me, this is all informed consent and informed choice, is that antenatally, we shouldn't just be having a conversation that is, you're going to breastfeed your baby, aren't you? Because there are so many benefits and it's going to help you lose your baby weight, which is sort of, unfortunately how these conversations tend to go. And we're not going to talk about formula because we can't talk about formula. What we should be saying is, actually, it's really up to you how you feed your baby. The most important thing is a well-fed baby and a happy parent.
Yes.
And, it's quite likely you're going to wind up using formula. And if and when you do, this is what you need to know. You need to know how to sterilize a bottle. You need to know, how long you can store for made up feeds in the fridge for. You need to know when you need to discard, an unfinished bottle, so you're not accidentally feeding your baby a Petri dish.
Yeah.
And you need to know that formula milk is essentially all the same. So don't be conned into spending, twice what you would otherwise pay for, a particular brand or a particular label within the brand. You don't need to do that.
Yes, it's not better.
Yeah.
Right. But so that's interesting because when we have policies like the baby friendly initiative, which are, I I would think well-intentioned, theoretically, but because they forbid any discussion of formula in hospitals after birth, they basically leave the field open to the multinational corporations to provide the education, right? So basically, all the information that parents are going to get is going to come from these multinationals, even though they are inevitably going to use those products. They're just left at the mercy of those corporate interests.
I think that's right. I mean, they say the road to hell is paved with good intentions. And I think that's definitely the case in this instance, because I think I absolutely understand why, in the context of the Nestle scandal in the 1970s, the World Health Organization took the position that it did, introduced the code on, restrictions of marketing, and all of this. However, what we're seeing now in the 21st century is that there are all these unintended consequences. And one of those things is certainly that because we're not having proper conversations about formula milk, and the formula companies continue to find ingenious ways to sort of circumvent the existing regulations, through implication with their brand labeling or through advertising unnecessary formula milks, like follow-on formula milks, and that have the same kind of co-branding as the infant formula milk. So they find ways around it. And no one's empowered or equipped as a consumer to navigate that. And so, and you also have a situation where, because you've got all these really strong marketing restrictions, actually it's very difficult for new entrants to come onto the market. So we've had a market study that was commissioned in the UK by the Competition and Markets Authority, which was published, I believe, earlier this year. And it essentially showed that there are two main companies that have 85% market share, which is Danone and Nestle. Basically, nobody else can come on the market because they can't tell anyone about their products. And so then you've got these, they can't advertise. So then you've got these two dominant main companies dominating through their different brands, and they can then dictate the price. And I think we've got to be really creative and imaginative now and think about, either we need to, be really robustly introducing lots of information antenatally about formula milk and having open conversations, which empower people as consumers, and also to make a much freer choice, free from stigma, about how they want to feed their babies. We should be doing that on principle, in my view. But I think we should also be doing it because I think it then has the potential, to stop these really disingenuous, dodgy practices from amongst the formula companies. And I think we should also be exploring things like price caps or price controls. And I think actually, I think there's a very strong case to be made, in fact, for reintroducing a national formula milk. Because I think one of the problems we have here is that this has essentially become a privatized decision that these profit-driven companies are benefiting from. When I would argue that when there is only one thing aside from breast milk that a baby 0 to 6 months can depend on, that it arguably comes into the realm of an essential medicine or something more like that. And that there's a case to be made that the state should therefore be stepping in, to provide this essential thing to babies.
And it's not that crazy, in fact, because in Britain, there was a national milk from
There was
1940 to 1976 or something like that.
Exactly.
Where actually the National Health Service had tins of formula that it provided at a very low price to parents so that babies would be fed. And this, arose in the context of the Second World War, but it's fed generations of babies in Britain sufficiently and ensured their well-being, and also made it affordable for parents to actually feed their babies, right? So that's what you're talking about, the national milk.
There's a precedent.
Yeah.
There's a precedent here in the UK. And also I think we can see precedents in the context of the COVID pandemic for when you can see that there is an enormous health benefit from something that the state steps in. We had that here in terms of like food boxes that were being provided to vulnerable people who were shielding during the pandemic and things like that. So I think, it is not beyond the wit of states to innovate in these ways, and there's precedent that's been set. Interestingly, like the national milk was phased out by Margaret Thatcher, the milk snatcher. Partly as a cost-saving mechanism, partly because at the time there were problems with the sodium composition of that particular kind of milk that was causing infant deaths. But I think sadly that, you know, it's sort of, it may have made sense at the time politically and clinically, but now I think we need a rethink on this because there is a problem even in the global north in terms of affordability and access. I mean, we've had reports which have shown very clearly that, particularly in the context of the rising cost of living and very high inflation levels, that people are rationing formula milk.
Yeah.
They are sharing formula milk. They're foraging for formula milk online. And this is not good from the point of view of infant nutrition.
No.
So I think we need to get creative here. And I think we need to rethink our policies and recognize that even if people had the best of intentions in the 1970s, particularly in the WHO, that we need a policy now that's fit for 2025 and beyond, and that meets the needs that we currently have.
Yeah. I mean, I was reading that baby milk is now one of the most shoplifted items across the UK. And I assume it's the case in the US as well, because how are people going to manage? The cost is becoming less and less affordable for low-income families. And yet we're telling women they need to have more babies. You know, there's the whole pro-natalist discourse, and we're not doing much to make the experience of maternity more manageable, you know, for women and for parents in general. So there's something's got to give, I feel, from a feminist perspective only. Yeah.
I think that's right. And I would add to that I think it needs to be giving in both directions, because I think, going back to what you were saying earlier, and again, just to make it very clear that I am extremely pro-choice on this. And I think what we really need are policies in, you know, the support, the choice, and the reality of feeding formula milk exclusively or partially. We also need to strengthen policies to support breastfeeding.
Yes.
And I think, you know, part of that is around increasing paid parental leave in contexts where it's minimum, and increasing the rate of payment for the leave, which, you know, is very, very low, certainly over here in the UK. We need to be doing things like creating a right to breastfeed or chest feed on return to work, and then creating the space and time to enable people who want to do that to do that. I think we also need to be providing more evidence-based clinical support.
Yes.
And that's a bit of a, you know, contentious issue because, again, there are questions about the kinds of interventions that are actually successful in eliminating common breastfeeding problems. You know, there's a quite intense debate about whether or not you can increase breast milk supply, for example, through lactation teas or, you know, pumping, or even through medication. And that, you know, there's been some rightfully, I think, some critique around, like, for example, the prescription of domperidone, which can cause cardiac problems to women to try to increase breast milk supply. You know, and again, we need to be very careful in terms of this road to hell being paved with good intentions, like the kinds of things that we facilitate, or, you know, that health policy professionals and healthcare professionals are facilitating in the quest for exclusive breastfeeding. And do we have a good evidence base that these things are actually effective? But certainly, again, I feel strongly that it's not right that we have a situation in the UK, at least, where we're all being told to exclusively breastfeed. The state support when you encounter problems is very, very low. You know, women say when their babies have tongue tie and they're not latching properly, they often have to wait extremely long periods of time to get the tongue tie cut. And again, there's a question mark about whether cutting tongue ties is really effective or not.
Yeah.
But again, you know, you can't essentially access it in a timely way on the NHS. And therefore, either you have the means, you go privately, or essentially you wind up probably not breastfeeding as you would want to. So you're really sort of set up to fail in this space, no matter what you do. It's the title of a report by a great organisation here called Feed UK. They said that we're being set up to fail because we're stigmatised if we formula feed, we're told to breastfeed, but then not given any practical support to do it. And so everybody just winds up feeling kind of rubbish about what they're doing.
Right. And so in a feminist perspective, then, you know, people would be supported to do what they want and what works for them, but they would have the support for all the options, right? So
exactly,
not, just one or the other, recognizing reality and also the autonomy of women and of parents to do what works for them, right? We've got to leave it to people. And also, I think in places where the water isn't clean, the power isn't available, so recognizing that we've got to support breastfeeding a lot more than we've done, but recognize that some people will definitely need formula, and they need to have a safe, affordable supply. And that's just not in the mix, in the context of the baby-friendly initiatives. So, yeah, there's a lot to think about as feminists.
There is a lot to think about, both on the level of principle and practice, I think.
Yes, thank you.
Absolutely. But I think we need to do that work. And I think we need to know this is, recognize this is not a settled issue. And that some of the policies and the thinking that were, born of a previous era, and while there may be still some resonance and applicability in certain contexts, we also need to recognize that some things have changed. And I also feel strongly that in relation to the global South, that we need to be aspiring for equal choice and parity between the global North and South. So whilst at the moment, absolutely, I think that the public health situation warrants an approach that recognizes that many people, if not most, in the global South won't have access to clean water, heat sources, sufficient quantities of formula milk.
Yeah.
And therefore, the case for breastfeeding is much stronger there. I think that we shouldn't stop there. I think we have to be, again, thinking, how can we create the choice for both of these things in that context for those people too? Again, ensuring clean access to clean water, in part so that people can formula feed for all the reasons that people in the global North want and choose to formula feed.
Right.
So
and clean water, because you should have clean water, right?
Because you should have clean water, absolutely.
No matter
for
what.
all the things.
For all the good reasons.
Matter what.
Yes, exactly. And not settling for something else, really thinking about individual well-being, and the experience of maternity as something manageable and feasible and empowering and respecting the autonomy of parents. Thanks for this very thought-provoking conversation, Rebecca. I really enjoyed it. I think we've got a lot to think about, and it's made me certainly rethink my perspective on that. My point of view has evolved in talking to you, so I'm grateful. And we'll see what the comments are when they start.
I'm nervous. Thank you so much for having me on, and for being willing to provide a platform to talk about what can be a pretty dynamite issue, and I'm sure will elicit lots of strong reactions. That's good. That's great. Yeah. I think, the important thing is that we debate this. Let's talk about it, right?
That's right.
Yeah.
Thank you so much.
Thank you.
Onwards. Bye.
Onwards. Bye.